Welcome to BizTech's Health and Wellness Show. Our conversation for today is with Dr. Lenzo Ling. He's the founder and CEO of GEM Clinic. Now, Dr. Ling is here to speak on the aesthetic medicine landscape in Malaysia and across the region, and including future trends that are driving this industry. He's also going to talk about this industry as an alternative career for medical doctors. Now, this interview is part of our media partnership with Diverse Career Summit 2022. Welcome to the show, Dr. Lenzo.
Yes, hi, thanks Brian, and thanks to all the audiences that will be present with us. Thank you very much for your very kind introductions, Brian.
Yeah. Now, Dr. Lenzo, just give us a quick overview about yourself and your history in the business.
So I've been in this industry for the last 15 years, 15. So I also the first Malaysian doctors to complete the full fellowships in Korea, so to finish this in this industry, and also board certified by the American. So basically, it's a double board offer in this aesthetic and regenerative medicines, anti-aging and wellness. And I would say that at this point of time, I'm the only doctors that having this double board in this area. So of course, beside that, I also doing a lot of training and coaching, and for all the clinical works for all the doctors community in the past for the last 1 decade since 2012. So I have been traveling around the regionally in mainly in Asia here, in Korea, even in China, Taiwan, Hong Kong, and ASEAN region here as well. And of course, lately, the last 2 years, I'm focusing a lot in Malaysia now, domestically. So I would say that it has been present to improve the upskill a lot of doctors in these aesthetic words. And definitely is my passion to continue pursue this imparting the knowledge and the skill sets to the younger generations of doctors that would like to embark into this industry, because aesthetic is a form of so-called modern medicines. It's no longer just a conventional doctors. But do you still need to become a doctor? The answer is yes. You need to become a medical practitioner to embark in these aesthetic industries.
Okay, now Dr. Lenzo, let's take a step back a bit, and I want you to give us a primer of aesthetic medicine. What exactly is aesthetic medicine, and what differentiates aesthetic clinics from spas and beauty salons?
All right. So aesthetic medicine actually, in the medical school, we don't learn the syllabus of the aesthetic medicine. All right, it never teach you how to do Botox, how to do fillers, how to do cosmetic skin lasers. So basically, of course, we train it as everyone until today. Most of the doctors that graduated as a doctor, they are trained like a conventional medical doctors. So basically, you deal with anatomy, physiology, pathologies, disease disorders, and then pharmacos, drugs, and the treatments and all this. So that is a conventional route that you graduate as a doctor, whether you stay in for 5 or 6 years. So you graduate as a doctor. So moving on, for those doctors who like to embark into the aesthetic, you need to be further trained. So basically, you need a lot of times in this further training that needed. Like for my own route, as I said that, more than 12, 13 years ago, I went to Korea. That's how I submerged myself over there in Korea, because if you want to learn, always want to learn from the best. So that's why I travel around and to learn it. So that's part of the aesthetic. So the primary is that the aesthetic is very different in the way that from the conventional medicines, because any doctors who like to embark into this journey to develop this career as part of their career, and you need to be re-upskills, basically. So what are the second question is, what are the difference between the aesthetic clinic and the spa and salons and others? Very simple. In the market perceptions, a lot of times there seems to be the same, but the reality is not true. So what is the reality is that aesthetic clinic is need a medical practitioner who are registered under the Ministry of Health. So besides that, the spa and these salons, it does not need to register under Ministry of Health. It's just under the City Council license. So, but in the Ministry of Health, of course, the regulations are more tighter, more stringent, because we are dealing with patients, real patients, right? And of course, for example, the drug allergic reactions, material allergic reactions, and there's some kind of wound dealing. Of course, we can't deal it in the spa or the salons. So there is the main differences. So all the practitioners who like to practice this aesthetic medicine, that need to practice inside the clinic premise. So they can't practice in the spa or salons. Yeah,
okay, and
that's
that's
a main
very,
difference.
very important, right, doctor? Because
Yeah.
at the end of the day, it's about patient safety. And this industry in the
Precisely.
past was less regulated than it is now. And you've had a lot of cases in the past where you have botched cosmetic surgery jobs that are done by unlicensed or unprofessional people, and people are scarred for life.
Yep. So it is still the same as per today, because a lot of things are still under the gray zone, right? And then but market perception, because the reason being is that a lot of people do not know where to go to find the right one. So, and a lot of this kind of bullshit that happen, it is because untrained or unlicensed, or even though some are licensed but not be very too skillful yet. So that could be a problem as well. You see, not just like a license and that it can be assuming that they are licensed and it should be skillful. But a lot of times I always educate that to find it the right one, you need to know that it must be find at least a clinic. Then you know that those are the real doctors. At least you are safe in certain form, right? If anything happen, I mean, these are all medical aesthetic procedures, right? Medical aesthetic procedures are bound to potential complications, right? Although we are dealing with enhancement, beautifications, everything is beautiful. There's dream, right? But we need to face the reality. On the other side, the complications awaiting us at the door. So at the practitioner, if that happen, at least you know that you are in the safe hand of practitioner. If it really happen, we will know how to rectify it at least. And we will know who to refer to, right? And then to get the solutions. But whereas for the unlicensed one, they do not know where to get the problem, and they do not know how to identify the issue, and they do not know how to refer and when to refer. That always delaying the process will complicate the matter most. So most of the time, I always say that because the practitioner, at least they know the basic hygiene, the safety, what do and what don't. And because they have a trained mindset of have the patient safety have to come first, other than the commercial side. So I would say that, of course, the main differences in the safety hand is still the most important. Yeah, besides wanted to get, enhance up, want to get more beautified. Yes, can be lucrative, sound like it, but yes, look out for the real and the good aesthetic practitioners.
Okay, then what are the sort of treatments that are most popular among Malaysians?
Okay, among Malaysia right now, a lot of times they like botox and fillers, and nowadays a lot of cosmetic skin lasers. So these are the common one. Of course, those are not those are some of the area like those are men's health and even the women's health as well. Like vaginal rejuvenations, even right, men's health, like and strengthening their sexual functions to improve the quality of intimacy in health. And of course, the hair itself, hair rejuvenation, these are all feel quite popular. But of course, talking about the ethnicity group of people, like for example, Chinese, they prefer like an eyelid surgery and no surgery, or the breast implant augmentations. So, but if you're talking about the India and the Malay community ethnicity, of course, their needs are different. They have a beautiful eyelid, they don't need the eyelid. They have a high nose, just maybe like a hump that they need to be corrected in some form. They don't need the augmentations. So, but generally they are looking for what? They are looking for the body contouring most of the time. So also depends on the ethnicity group of a people, and also depend on the age group of the of the patients. The younger the patients, usually they are looking for those like we call it a minimally invasive procedures like botox, fillers, and some kind of minimal aesthetic surgical procedures like eyelid. Those are the younger generation. But of course, moving on to the mid and more senior patients, they are seeking for the facelifting generally. So because the needs are the problems or the concern are different as the age advancing. Yeah.
Okay. Now, can you tell us, because this seems like an awfully large industry globally, and it seems to be growing very rapidly in Malaysia. Could you give us a sense of the size of the business, size of the market?
Okay. In Malaysia, the size of the market is still very small. Generally, globally, they are growing at a compound annual growth rate of about 10% annually, right? CAGR of 10%. If you're talking about the Malaysia, we are eyeing at around 20 to 30% growth rate.
Okay.
Right. It's more than the global standard.
Okay.
Yeah, because why? Some of the country already reaching its plateau, like Korea, they're reaching its plateau. Like Thailand is also very advancing, right? We are surprised, our neighbor, right? It's very advanced. And coming back to Malaysia here, that's the size of it actually. A legal practitioner or registered practitioner, the size is just too small. But the unregistered one, the size is big, ironically. So it can be so scary, you see. So that's why a lot of times educations and the transformation of this landscape, it need a lot of competent professionals, practitioners to come out, to stand up, and to educate the public about this industry itself. So I would say definitely a lot of uncharted. That means because they are not registered, right? A lot of things are under reporting. So we can see that it's just at the tip of the iceberg at this stage in Malaysia right now.
Okay, that's an interesting point, Doctor, because then, Dr. Lenzo, you also see a trend where more and more medical doctors are leaving, for example, the government practice to go into aesthetics. Now, what is the attraction there, and how does it add value to their training and also obviously future career prospects for doctors who want to move away from being a medical practitioner only?
Yeah. I think because of the healthcare current situations, so that's why be part of the diverse career to support it. And so we would like to channel the doctors, to others alternative of practice or other alternative of their career advancement. So a lot of doctors being trained, right? They thought that, their road is only go beyond specializations. That's it, to go into master level. But now in this time, it's no longer anymore, because a lot of times they are in the contract status, which is very difficult for them to have an opportunity to step into the master program to advance into a specialist. So that's why a lot of these doctors, young doctors, being pushed out of the system. And there is aesthetic medicine is one of it. So there's a lot of inflow, like overflow over into this aesthetic industry. So it's very crucial and important to have a training system for them, because the training system is the one that to cater them for like basic training, intermediate training, and a master or advanced level of training that needed.
Okay, Dr. Lenzo, could you then break it down for us? If I'm a doctor, I'm a contract doctor in a government service, and my contract is ending, or I've basically had enough with public sector, I want to go into the aesthetics. What do I need to do in order to be properly qualified? What are the steps that I need to go through?
All right. First things first, you need to be equipped with the knowledge and skills, right?
How do I get that?
So you go through the academic part, and you can come, to the academic regions, and we do a lot of training as well. And then they get it over here. And some of them, they have others academic training as well in the market. But you can go like a basic, to go into getting some knowledge and equipping some skill set in it. As you move on, then you realize that, then you need to get into some established aesthetic clinic in the market, so that you can get a place where you can practice. Because a lot of times, even though you go through the academic training, but if you don't have a place to practice, you can't learn your skill set. You know what I mean?
Like everything else.
So that's why we have a few hundred over doctors always knocking our door. So every day, like I've been interviewing 2 or 3 doctors at least minimal, to screen them through. So because we wanted to get good competent attitudes and good character doctors to join in, because at this stage, what they really need is the knowledge and skill sets. So that's why we are focusing into that, to equip and develop them in that area of arena, before we're talking about re-upskilling them later stage, you see. Yeah. So there is a training that in place. But of course, in Malaysia, there's something called LCP, Letter of Credentialing and Privileging, whereby this is set by the Ministry of Health, that all the aesthetic practitioners who would like to embark into this journey, into this industry, that you need to be LCP certified before you can be independent, proper certified aesthetic practitioner. So
so how long does this take, doctor? This process from me being a contract doctor to a LCP doctor?
5 to 6 years.
5 to 6 years, okay.
That's right. Yeah.
So once they are fully certified, they can go out and open a clinic of their own and so forth.
Exactly. Okay. Yes. Once they have this LCP, they can open their own clinic and they can practice independently. Yeah.
Okay. Now, Dr. Lenzo, Looking ahead, what's the future of the aesthetics industry and what are the key market trends right now driving the aesthetic medicine?
Okay. The future of the aesthetic medicine definitely is very bright, especially in Malaysia. We are in the right country, right position, in the right timing, actually. If you're talking about in the Thailand, they're already, or in Philippines, they are very saturated, actually. They are very advanced in a different level, but in Malaysia, there are a lot of growing, room for potential to grow. So the future of the trend itself, actually, that moving on, the technology involvement in this industry itself, whether in the cosmetic laser technology involvement or the techniques and arts of injecting, or the material or more sophisticated or more advanced or friendly material that for the body or for the face to use, in this. So a lot of times the advancement, that the re-innovations will be continue moving on. So there are a lot of changes of innovation in the products, in the technologies, as well as the technique itself over the last 1 decade, especially. Yeah.
And Dr. Ling, then, final question. What is advice that you would give potential entrants to this industry in terms of doctors? What are golden nuggets of advice, given your experience, that you will give them?
Okay. The golden nuggets that I always tell the young junior doctors is this. All right. It's not about what you learn. It is about who do you learn it from. If you want to be the best of the best at the top notch in the country, you need to learn from the best always. Always strive for excellency in mind, and never be happy that you're just getting a surface knowledge. Go deeper in. Then in terms of knowledge and skill sets, you will become successful one day, for sure.
Now, Dr. Lenzo, it's been a fascinating conversation, but before we leave, any final thoughts you want to leave the audience with? Okay.
I hope that the audience itself, you can make a right decisions if you're really passionate about this aesthetic medicines, right? And you really have to think through it, because the journey is totally different from the normal hospital environment. If it's really what you want, right? Because I had seen that a lot of some other doctors, after practicing for 5, 6, 7 years, 8 years, they withdraw from it, and that, I found out that this is not what I want. But it's really embarking into it, think properly, give a deeper thought. Is that what you really need? And what you really want to advance your career? Because itself, the patient expectations, the management itself, and then the way you run the clinics is very different from the general practitioner or the conventional medical practice. So give a proper thoughts before you start your first journey. It's not like a trial and error, But a lot of times they are, actually, because I just need to explore and see what it is about, right? So the reality is still a reality that. That's it from me, Brian. Yes, thank you.
Thank you so much for taking your time to be on the show.
Yeah. All right. Thank you, Brian. Yes, thanks for your time. Thank you, everyone.
I'm Brian Fernandez, and we've been speaking to Dr. Lenzo Ling, the founder and CEO of Gem Clinic, on BizTech's Health and Wellness Show. This conversation is part of our media partnership with Diverse Careers Summit 2022. This video and podcast will be on our various social media platforms, as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thanks again for tuning in.